Hi everyone. Oh, let me take the old lady things off. Hey, gotta see nowadays. Anyway, so I just got back from the surgeon's office, and you always see there's a doctor you see before you see the surgeon. So that was this appointment. And the surgeon is the final word, finally, like the deciding word. Although the doctor that I see is amazing, and it's pretty much always the same thing. But so he ordered the MRI and everything, so we have to wait for the insurance company to approve it, to say yes, it's medically necessary that we take a look at your back. Not that a surgeon had anything to do with it, but geez Louise. But anyway, New Jersey insurance and what you have to go through. Anywho, so it's more than likely going to be a surgery, another surgery. They're going to go in. I have the top of my neck and I have bottom of my back. And what they're going to do is take out the hardware, put that back in with additional spaces. I have cadaver, artificial, and hardware and everything. So that's going to come out and then new come in. And the MRI will see, how far along the nerves damage is. This spinal stenosis is how far along that is. But I also have to get my scoliosis scans. I have scoliosis, so those scans have to be redone before the surgery is done, just to map everything out. So everything's on hold as far as, lifting weights and things now. I'm sticking with my nutrition, and so we'll go from there. Now we wait for the insurance company to say, okay, or we got to battle it, whichever, and see what happens from there. But yeah, it'll be basically, I'm just going to take this time I have to go to Goodwill and get the porta potty, whatever you call that, the potty thing. I'd given away so much, but I still have my walker because I was still using it. And I have the grabby thing, the long arm thing to grab stuff. And they have like the workers that come in, nurses, like a physical therapy kind of. You have to figure out how to put your underwear on when you can't bend, and they have like little helper, like little devices to help you get your socks on, just to show you what to do, and that all went back when I didn't need it anymore. But they got things so that when you got to go to the bathroom, you can clean yourself. It's so because they want your spine to stay. So I was braced up last time, so I'm fairly confident it's going to be a brace. I was braced and necked and the whole caboodle. So we'll see what happens this time. But yep, sticking with my nutrition, and I guess we'll get all these tests done. I'll go through the house and see what I need to do. I need to find the plug for my chair. I have this chair that lifts you up so that you can stand, like it brings you all the way up, so it's easier to get up, especially in the beginning. In the beginning, you absolutely need it, trust me. Whew. But there's a part of me that's kind of I really thought losing the weight was going to keep me from that surgery. And Dr. John today, he kind of explained it, degenerative, how do you say it? Degenerative discs don't get better. You ease up that pressure, but it's something that doesn't get better. Just like the word degenerative, it gets worse. So like, oh man. But he says it's easier, especially during surgery, because they have to move you around. And over 250, 252, slapping that around on a table is a little bit easier if you can get that under the 200 mark. You know, it's just harder to move you around, and they need your spine to stay put, especially when they're taking out vertebrae and putting new in and everything like that. You can't, you know, move. So you just really, it would be helpful if I had just lost a little bit more, but I'm going to keep on my nutrition, and it'll help for the healing. It's going to help a lot with the healing. And nutrition is a big key factor in that. You have to be really careful what you're eating because you want your bones. I'm 55 years old and already all these problems with my skeletal system. And I want to enjoy my old age. So I have a grandbaby due anytime. She's 80% effaced and just 1 centimeter. So she's got a little bit of time. She's coming up close. Her due date's coming. And but I'm excited for that. Kind of about another surgery, but I don't want to have to do it when I'm 65. You know, I'd rather do it now than 10 years from now. So I'd rather not do it at all, to be honest with you, but I really would like the pain relief. And he asked if it was getting worse, and to be honest, it is. And I know where I was at before in pain from the other one. It was bad. So anyway, I'm on the path. I'll keep you up to date, and just trying to keep positive.